You must have heard a lot about alcohol. Today we are going to talk about effects of alcohol on your pregnancy and during breastfeeding. Many women indulge in taking alcohol because they don't know whether it is harmful or not, or how to navigate taking alcohol. Yes, there's a way to navigate taking alcohol, especially during breastfeeding. Okay, so in this video, we are going to talk about effects of alcohol during pregnancy on you and your baby, and effects of alcohol during breastfeeding, and how to navigate taking alcohol during breastfeeding. Welcome back to my YouTube channel. I am Dr. Ifnaya Igweze, and I am the co-founder and CEO of Predify, a one-stop platform that provides 24-hour pregnancy support for career and business women. I talk about all things preconception, pregnancy, and childcare. If this is a topic that interests you, please do well to hit the subscription button and turn on your notification to know when I upload my video every day. Talking about alcohol use in pregnancy, there is one important fact that you need to know, is that there is no safe level for alcohol in pregnancy. So you can't say, oh, I'm going to take just one bottle or one glass or just half glass and it's going to be safe. No, there is no known safe level of alcohol during pregnancy. And one fact you also want to know is that when you take alcohol in pregnancy, it goes directly to your baby's placenta and enters into your baby's bloodstream. So your baby can be as intoxicated as the mom. Your baby shares the same alcohol level with you because he or she has direct access to the level of alcohol in your system. Alcohol use during pregnancy can result in fetal alcohol syndrome. Fetal alcohol syndrome is a complex of manifestation resulting from alcohol use in pregnancy. It could be physical or intellectual. Physically, your child might show facial features that suggest that they have negative impacts of alcohol, like small head, low set ear, flat nose, like your child face should not be looking normal like every other kid around. Apart from physical features, your child can develop intellectual developmental delays and may not achieve its milestone at the right time because of fetal alcohol syndrome. Fetal alcohol syndrome might not manifest immediately you give birth to your baby or a few months along that. It might be later in life your child can develop behavioral problems or have difficulty with learning in school or catching up with things that his peers are supposed to know about life. Another problem with alcohol use in pregnancy is miscarriage. Yes, alcohol use can increase your risk of having a miscarriage or giving birth to a dead baby. That is stillbirth. So, the best advice I'm going to give you is to stay away from alcohol use during pregnancy. If you're still with me, please do well to subscribe to my YouTube channel and hit the like button to help YouTube to push these videos out to more mothers. Let's talk about effects of alcohol use during breastfeeding. During breastfeeding, when you take alcohol, it is secreted in your breast milk. Remember that there are certain things that you eat or drugs that you take that are not secreted in your breast milk, but alcohol is not one of them. Once you take alcohol, it is directly secreted in your breast. So your baby can get it through breastfeeding, and it can damage the immature brain, liver, or kidney of your baby. Taking alcohol too can reduce your breast milk supply. So if you are breastfeeding and you're not getting enough supply and you take alcohol, you may want to stop taking your alcohol to increase your milk supply. Alcohol also have negative effects in babies by delaying their development. They may not be hitting their milestones, they may have poor motor reflexes, and they may have difficulty with speech or learning abilities. But will you now starve yourself of alcohol, especially if you're someone that loves to take alcohol? What are you going to do, especially now they have put to bed, but you cannot just abstain from alcohol entirely? Number one thing you need to do is to limit your alcohol intake to occasional drinking. Yes, you crave alcohol, but don't take it every time, to reduce exposure to your baby. Do occasional drinking and plan your drinks. Okay, what you need to do is make sure you take alcohol 2 to 3 hours before your next breastfeeding session. This will help your body to get rid of this alcohol before your baby starts nursing. But if you take excessive alcohol, like more than 1 bottle or more than 2 glasses, you are going to stay for a longer period of time before breastfeeding your baby. One way to work around this is to express breast milk. For instance, if you are going out to hang out with your hubby or friends, I know that you're going to take a lot of alcohol. Express breast milk enough that will be able to serve your baby for at least 12 hours and store in your fridge so that your caregiver or whoever is available can use that breast milk for your baby. Those breast milk is not contaminated with alcohol. So you can go out, have your fun, take your alcohol and come back home. There is no pressure on you to breastfeed your baby. There's something mothers do when they go out to take alcohol. They come back and use their breast pump to pump breast and discard. In their mind, they feel like, oh, they have already discarded the alcohol with that breast. No, it doesn't work that way. Okay, you need to give your body time to naturally get rid of alcohol before you start breastfeeding your baby. So if you are taking more than like a bottle or a glass, make sure you give yourself over 3 hours to allow your body to get rid of it. And while you are doing this, make sure that your baby doesn't starve by expressing breast milk that the baby can take through cup and spoon. I hope these tips help you to understand what alcohol does during pregnancy, how it impacts your pregnancy, and how you can work around it during breastfeeding. Thank you so much and see you in my next video. Remember to subscribe.